Thank you very much, Madam Chair. Let me concede Senator Burr's point that just because you sit on a committee of jurisdiction in Congress does not make any of us subject matter experts on the areas in which we hold hearings. But sitting before us is a healthcare expert. I worked with him very closely in the House on the development of the ACA. I've watched his work as Attorney General. This is someone who is in the weeds of healthcare policy, healthcare coverage, and I think we're very lucky to have him lined up to be the next secretary. I wanted to, frankly, build off of Senator Braun's comments because I think the healthcare industry delights when we spend all of our time here talking about who pays instead of how much we're paying. I mean, we sort of talk about healthcare in this country as if it is primarily a question of coverage, whereas the real problem here is a problem of price. And you've done a lot of work in this area. I think a lot about the Sutter Health case, in which you went after a huge healthcare provider that had essentially cornered the market such to drive up the costs of deliveries in the Sacramento area so that nobody in the country was paying more than families were to deliver a baby there. From your experience working in this area of trying to assure competition, both in the provider space and the insurer space, so as to drive down prices, what do you envision the federal government is able to do to try to make the marketplace? And I think transparency is a piece of this, but some of this is also just anti-competitive practices amongst providers and insurers. What can the federal government do here to try to have a functional marketplace in which prices are going down rather than being set?
So, Senator, first, I appreciate the question, and it's great to see you again, and hope to have a chance to work with you all, as well in the future. I actually think Senator Braun hits on something very important, and transparency. If consumers knew what they were paying, they would really push to make sure prices go down. Not that just they know the price, but that the price goes down. That's why our effort was supported up and down the state of California when we went after the largest healthcare provider in Northern California, because people just had an instinctive feeling that the prices they were paying were way too high. And so what we have to do is be able to go behind the curtain. You have to be able to see how they're operating, how they're cutting some of these deals. And that is important. You all can help in Congress to give us the tools to enforce. And I would hope that I could work with you in the future to make that happen, should I have the good fortune to be confirmed. I would also tell you this, that we want to always spur innovation, and we need the pharmaceutical industry in America to always feel like we've got their back to innovate. COVID is a perfect example of how we can come up with a vaccine, but we have to make sure we're getting our dollars worth. And I think there is where you all can give us more tools to make sure that we're getting our money's worth from all the different stakeholders in the industry.
I think transparency is a great place to start. I think there are limits to the gains you can get with respect to transparency alone, because the most expensive interventions people have with healthcare system are often at the moment when they are least able to shop around. And so I think the work that you've done, to try to really go after these monopolies or these quasi-monopolies, that I think is really important. I look forward to working with you on that. My second question is around another issue that I know is very important to you, and that's mental health parity. We have a great bipartisan coalition on this issue because we've already got a law in the books that says insurers have to cover mental health just like they cover physical health. But we know that that's not really how it works out there. Anybody who's got a child with a mental health diagnosis can tell you they got to go through hoops and red tape and bureaucracy that nobody has to go through when they are trying to get cancer treatment or reimbursement for an orthopedic procedure. Tell us a little bit about your commitment to this issue, how you think that HHS can really push forward, because we don't necessarily have to spend a lot more money here. We can just make sure insurance companies are actually providing the benefit that they have promised to people, and we'll get a whole bunch more mental health coverage paid for.
Senator, you said it right, and I could take you back more than 30 years when I started working on this issue representing folks who had mental disabilities. We have, as you said, the laws in place. We just got to enforce them. We have to do the oversight. And there I would look forward to working with you to do that oversight, to make sure that the stakeholders in our health system are enforcing, are applying the law correctly. We have to make sure that we don't let people fall through those cracks. We have to coordinate with the Department of Labor, because the Department of Labor has a lot to do
Yes.
with how these programs are implemented to get us to parity when it comes to mental health services. And so we can do a lot. And I know many of you are trying to work on this. I look forward to working with you on this, because it is the hidden secret out there that everybody knows about the need to do more, but too often the what's left in the crevice is reaching parity when it comes to mental health services.
Great. Thank you, Madam Chair.